Remember, we're talking about everyone who's admitted to hospice. They have to have a terminal diagnosis and evaluation of the specific criteria of that diagnosis to paint the picture to Medicare that this patient is ready for hospice admission. Let's continue on with the review of specific requirements for our major terminal diseases, and we've moved on to cancer. There must be clinical findings of a malignancy, or that could be confirmed through pathology or radiation, but sometimes the patient refuses the process of a full diagnosis, such as biopsy. So what do? There must be the physician's description of the basis for that presumptive diagnosis. The patient is refusing curative care, such as chemotherapy or radiation, or the patient is no longer actually a candidate for any of those therapies. There must be documented evidence that this is an end-stage cancer. Perhaps there's metastatic disease progression, and that would be through an oncologist, radiologist. Perhaps there's some recent lab that demonstrates disease progression. The PPS score must be 70 or less. In the absence of the immediate physical need for hospice intervention, the patient could have psychological needs that are shown to require hospice at the time. Somewhat more difficult to document, as you might consider. The patient might be staying alone, they're depressed, they're afraid to sleep because they won't wake up. Perhaps they have remorse about the lifestyle that may have led to the disease, such as smoking with lung cancer. So do document the psychological needs. The patient may be requiring a lot more significant pain management. They may need to increase a narcotic load, something that's it's preventing them to have regular ADLs and enjoy life. So remember, be a detective, be observant, listen closely, advocate for the patient, know that it is your job to find all of the information you can and work with that medical director so that you can get that patient admitted legally to Medicare. Don't forget to use our booklet whenever a patient is admitted to hospice. Watch our daily videos, and please send your comments and questions in so we can get back to you with our blog. Care is treatment.